Hi, I'm Dr. Flavia.
And I'm Dr. Swabra Swale. We are from
Gynetics Kenya, and today we are talking about preconception care.
Karibuni.
So what is preconception care?
I would say, loosely speaking, this is care offered to a woman before she gets pregnant, before she plans on getting pregnant, just to make sure she is in the best of health.
We can also say to the couple, not just to the woman.
Oh, yeah, but there were two people. So it's care given to the couple, just to prepare them better for the pregnancy.
Yes.
And here we are addressing several aspects of your life in preparation for the pregnancy to come. Okay.
So as we talk about preconception care, most important part is talking about lifestyle. Okay, not most important, but part of it is talking about lifestyle. That means trying to get into your appropriate BMI.
BMI, true.
So whether you're underweight or
overweight, very true. And so if you're underweight, we might want to increase your weight to normal. If you're overweight, we might want to start exercise to bring it back to normal.
Okay.
We might also be talking about smoking maybe. If you're a smoker, you may want to stop smoking or maybe just reduce on the smoking.
And that's for both men and women?
Exactly.
And alcohol intake, to reduce alcohol intake.
Exactly.
Because most times by the time you know you're pregnant, it's past 4 weeks during the organogenesis, the period when the baby
has formed. And so you may not want to have been exposed to alcohol
during that
and
period.
All these chemicals, exactly. All right. One aspect to be explored is drugs, Dr. Flavia. And we assume that when you get pregnant, of course, we put you on multivitamins and they are good. But you see, by the time you're pregnant, you're using already what you have. We needed to have stocked these resources even before pregnancy. And so the drugs we start...
months, yes, at least 3 months prior to conceiving.
And we start on folic acid,
which is the most important one.
There are special considerations, though. For example, a woman who has had a baby with congenital anomalies, a problem, for example, we may want to up the dose of folic acid, and so we may not give you the normal doses.
If epileptics as well?
Yeah.
If they're on medication,
the drugs, yes.
Yeah, if you're also on medication, we'd need a higher dose of folic acid.
So basically, there are drugs to be stopped, drugs to be upped, drugs to be maintained, and conditions to be controlled before you start getting pregnant.
That's an important part of preconception care.
Exactly.
So another aspect of preconception care is tests. So there are certain tests that we may need to do. So we can start off with the routine tests that you would do, like knowing your blood level, knowing your sugar levels, having an STI screening, HIV, syphilis, those kind of things that we may need to put your medication before or treat before.
Exactly, because you can pass these diseases to the unborn child. Exactly. There are also different kinds of tests that we may do based on a strong family history of some condition. So, for example, this woman who has a family history of thalassemia, sickle cell disease, I may want to screen the couple. Are you a sickle cell carrier? Do you carry the trait? Just before both of you come in and then make a baby who has, for example, a full-blown disease.
Yes,
we know the disease burden of such conditions. And so we may want to help you make an informed decision just
prior
before.
to
Exactly. And so that is based on the history provided by the couple.
So in conclusion, Dr. Swabra, we would say preconception care is necessary.
Very. And then also, we know that most babies are totally unplanned for, but welcomed. But maybe we can change the narrative that we maybe should plan for these babies to ensure better health for both mother and baby. Exactly.